All right. Hey, everybody. I am back again with an anatomy physiology lesson walkthrough. So the last couple of lessons, we were looking at the respiratory system. Now in 5.1, we're going to talk about the urinary system and the issues that may come up with the urinary system. The urinary system has a primary function, and that is to excrete metabolic waste. This system is also responsible for the water and electrolyte balance. And electrolytes, think of as salt, balance within the body. Now, the structures that make up the urinary system are the kidneys, ureters, urinary bladder, and the urethra. There's a good picture of our excretory system. Now, the kidneys are two bean-shaped. They do look like beans inside the body. The kidneys are intertwined with blood vessels to carry out the process of urine production. The kidneys also filter blood. The kidneys are located on each side of the vertebral column level with the 12th thoracic to the 3rd lumbar vertebrae. Ooh. Sorry about that. Okay. And the kidneys are retroperitoneal, and that means they are posterior to the peritoneal cavity. Retro means back, so it's like behind the peritoneal cavity. And this cavity is located within the parietal peritoneum. And this is a serous membrane that lines the body wall. It forms a sac that contains the following abdominal and pelvic organs. So this is near your abdomen, your stomach, and then your pelvic, near your pelvis. And those are the stomach, liver, spleen, pancreas, intestines, and reproductive organs. Each kidney is enveloped in a fatty, fibrous pouch. This pouch has 3 layers: the renal capsule, the renal adipose capsule, and the renal fascia, seen here. The renal capsule is the inner layer of the fibrous pouch that contains the kidney. It forms a strong fibrous attachment to the kidney. It helps protect the kidney from trauma or the spread of infections. The renal adipose capsule is the middle layer of the fibrous pouch that contains the kidney. It is formed by a firm protective layer of adipose tissue or fat. Adipose tissue is fat. And lastly, the renal fascia is the outer layer of the fibrous pouch that contains the kidney. It anchors the kidney to the peritoneum and the abdominal wall. And within each kidney are 3 distinct regions. You have the renal cortex here, the renal medulla here, and the renal sinus here. And each of those are described below. The cortex is the outer layer of the kidney. It's light red and granular because it is filled with capillaries and microscopic tubules. So tiny little tubules. The renal medulla is deep to the renal cortex. It is dark red, striped because of the microscopic tubules and blood vessels. It contains 8 to 15 renal pyramids. The renal sinus is an open cavity in the center of the kidney, and it collects and transports urine to the ureter. So here we see the little cavities in the middle, and that is where it collects the urine. There are 2 ureters in the body, one extending from each kidney. Ureters are hollow, tubular organs, about 10 inches long. They transfer urine from your kidneys to the bladder, the urinary bladder. The ureters have an inner mucosal layer and an outer layer of smooth muscle. Muscular peristaltic waves push the urine along. There's one urinary bladder in the body. It's a storage sac for the urine, and it's located posterior to the symphysis pubis and the anterior to the rectum. So it sits right in the middle of your body, down there in the lower region. The walls of the urinary bladder have 4 layers: mucosa, submucosa, muscularis, and adventitia. The mucosa is the inner layer of the urinary bladder. It has several folds to allow for expansion as the bladder fills. It also forms flaps that act as one-way valves to prevent reverse flow into the ureters. The submucosa is the second layer of the urinary bladder. It supports that mucosa layer. And we have the muscularis. That's the 3rd layer of the urinary bladder. It's composed of smooth muscle. It forms an internal urethral sphincter. You see that there. Then we have the adventitia, and that's the outer layer of the urinary bladder. It's basically a continuation of that parietal peritoneum. Then finally, the urethra is a tubular organ, and it sends urine from the urinary bladder to the outside of the body. The walls of the urethra have 2 layers, a mucus layer, and then a smooth muscle layer. And this smooth muscle layer forms the external urethral sphincter. So we have an internal urethral sphincter here, and then we have the external urethral sphincter here. The urethra of a female is about 1.5 inches long. The urethra of a male serves both the urinary and reproductive systems, and it's about 8 inches long. Urination is releasing urine from the bladder. It is a response to involuntary. You don't consciously control nerve impulses to the internal urethral sphincter. And then voluntary, you can consciously control nerve impulses to the external urethral sphincter. So think of involuntary pairing with the internal sphincter, and then the voluntary, you do have control of the outside or external urethral sphincter. The average capacity of the urinary bladder is 700 to 800 milliliters. At about 200 to 300 milliliter, stretch receptors send involuntary nerve impulses to the internal urethral sphincter. Voluntary control of the external urethral sphincter doesn't normally develop until 2 to 3 years of age. That's why diapers are very useful for the first few years. The primary function of the urinary system is to excrete metabolic waste. We talked about these structures, the kidneys, the ureters, the urinary bladder, and the urethra. And that's it for describing the urinary system. And now we're going to look at issues. The issues that can develop from the urinary system. And this can occur for several different reasons: congenital malformation, infection, trauma, and obstruction of urine flow. So we're going to examine an example of each of these. Renal Agenesis, urinary tract infections, bruised kidneys, and then kidney stones. Renal Agenesis is a congenital malformation, and all that means is it's a problem that develops when you're in the womb. So at a very early state, renal agenesis is when one or both of the kidneys do not form. Normally, the kidneys develop when the fetus is about 5 to 12 weeks old, and by week 13, the kidneys are already producing urine. If both kidneys fail to form, it is known as bilateral renal agenesis. That actually results in a stillbirth. And sadly, that means the baby dies before it is even born. If only one kidney is absent, it's known as unilateral renal agenesis. And individuals with unilateral renal agenesis may not have any symptoms. They just have one kidney. So what are the risk factors? Usually there's no family history of this renal agenesis, but in about 20 to 36% of these incidents, there is some type of genetic link. Women who have gestational diabetes have a higher risk of having a baby with renal agenesis. And it's also more common in male fetuses for some reason. Treatment prevention, bilateral renal agenesis, if both kidneys don't form, that is fatal. Unilateral renal agenesis may not require any treatment. One healthy kidney may enlarge to be able to perform the necessary functions. And that makes it very important for people that only have one kidney to keep it healthy. So they may undergo extra testing to avoid infections. They may also be encouraged to avoid contact sports that could injure your kidney. Next thing to look at, next issue, is urinary tract infections. That's when bacteria enters your urinary system through your urethra and travels further into the urinary tract. Most of these urinary tract infections, or UTIs, are bladder infections, and they're not serious if you treat them quickly. So if you're quick about treatment, they're usually not serious. Kidney infections, that's when the bacteria goes all the way up to your kidneys, and that can be very serious. So that can permanently damage your kidneys, and you may also die. So kidney infections from UTIs are no joke. So what are the symptoms? If you get a burning sensation during urination, if you have to urinate a lot, if it's painful when you urinate, if your lower back hurts, if you're vomiting, feeling nauseous, cloudy, pink, or foul-smelling urine. So basically, if something's funky going on anytime you have to pee, that may be a sign of a UTI. What are some of the risk factors, though? They're more likely to occur in girls or females. That's because females have a shorter urethra, and it's also closer to the rectum, which has a lot of bacteria present. So it's sort of just by design of the human body that bacteria is closer to the female's urethra, and the urethra is also shorter, so bacteria doesn't have to travel as much as in male urethras. Sexually active women are at a higher risk of UTIs. UTIs are also very common during pregnancy. So you just have to be careful. Both guys and gals, but especially if your body is female, you just have to take extra care that UTIs do not become an issue. But if you do get a UTI, how do you treat it? Individuals with a UTI will be given an antibiotic to kill the invading bacteria. They will also be advised to drink a lot of water, and that will hopefully flush out the bacteria. How do you prevent it altogether? Young girls should be taught to wipe their vaginal and anal regions front to back, right? And that's the safest way for you to not get bacteria into your urethra. Drinking a lot of water also helps prevent UTIs from even starting. Cranberry juice has also been linked to helping prevent UTIs. Actually, we should probably look that up later. After intercourse, women are advised to immediately urinate to help rid the body of bacteria that was introduced. So, you heard it here first, folks. Well, maybe not. Hopefully you had this in sex ed. But there are sanitary ways to take care of your body, lots of water, and then flushing out any potential bacteria is your best bet. Bruised kidneys, that's a result of trauma to the lower back. And if the trauma is severe enough, it may even rupture the kidney. Symptoms of a bruised kidney include pain in the lower lumbar region, bruising in the lower lumbar region, blood in your urine, and that is known as hematuria. What are some of the risk factors? Bruised kidneys are usually a result of trauma, like if you're in a car accident, if you fall, a pretty bad fall, or if you're in a contact sport like football, rugby, any sport where you're like expected to collide with other people, that can bruise your kidneys, and that's no fun. So be careful. That's all I'm trying to say. Well, let's say you do get a bruised kidney. How do you treat it? Before any invasive treatment is done, the individual will be advised to rest and see if the body can repair itself. Surgery to repair the kidney may also be required. If repairing the kidney is not possible, the kidney may need to be removed. So, yikes. Let's say we want to prevent it altogether. How do we prevent kidneys from getting bruised in the first place? So, you may not always be able to prevent trauma to the kidneys. Sometimes things just happen, right? But some tips can reduce the risk, like wearing safety equipment when you're playing contact sports, wearing your seatbelt, and driving safely. Yeah, because car crashes are, it's just horrible. And lastly, that brings us to kidney stones. Kidney stones, or renal lithiasis, are small, hard deposits of mineral and acid salts that obstruct the flow of urine. Kidney stones develop inside the kidneys, but symptoms may not occur until it moves into the ureters. Here we have a picture of a kidney stone. Look at that. What are some of the symptoms? If you have severe pain located anywhere in the back to the groin area, that's a bad sign. Pain that fluctuates in intensity. If you're constantly feeling this urge to urinate, and once you urinate, it's painful, or your urine smells interesting, or if it's another color other than like pale yellow to clear. If it's pink, red, or brown, something's going on. What are some of the risk factors? If you have a family history of kidney stones, if you're over the age of 40, hey, it's a little riskier. Males get kidney stones more often than women do. Eating a high sodium, high protein, or high sugar diet can be a risk factor. Not drinking enough water, especially if you live in a humid place. Well, how do you pass it? How do you treat these things? So, like we've said before, drinking a lot of water to help flush the stone out. Pain medication to help reduce the pain. A doctor may also give you a medication that will help relax your ureters to help the kidney stones pass quickly. Or more quickly, I should say. Some kidney stones won't pass on their own, so some procedures may have to be utilized, like removing the kidney stone with a scope and special tools that break the stone into smaller pieces. Shock waves can be used to break the kidney stones into smaller pieces. And then surgically removing the kidney stone is an option if those other methods don't work. Well, how do you prevent it altogether? Drink water throughout the day. Eat a low sodium diet. Limiting the amount of animal-based protein you eat. You actually don't need as much protein as those supplement companies like to advertise to you. And be wary of taking calcium supplements. If you're getting enough calcium in your diet, you don't need to supplement that with additional calcium. For individuals with reoccurring kidney stones, a doctor may prescribe specific medication to help prevent kidney stones. So finally, in conclusion, the urinary system has a very important role. Some of the problems that interfere with this role include the things we talked about: renal agenesis. That's when a kidney doesn't develop while you're in the womb. Urinary tract infections, bruised kidneys, and kidney stones. All right, that's it for urinary system and urinary system issues. If you have any questions, message me in Canvas and I'll help you out. And that's it. So great job, everybody. I will see you all next time. See ya. Bye.